Hello, everyone. Hi, everyone. Thank you so much for joining and welcome to our session on built environment conditions and health. My name is Kelvin Fong. I am an assistant professor at Dalhousie University. I am co-chairing the session with Dr. Michelle Bell, who you can see on the screen, who is a professor at Yale University. We have four very exciting speakers today, so it's my pleasure to introduce our first speaker, Dr. Carolyn Stevens, who will give a talk on globalization and health justice. Dr. Carolyn Stevens' background is in literature and philosophy, and she has also completed a master's and PhD in environmental epidemiology at the London School of Hygiene and Tropical Medicine. She's a professor at the UCL Bartlett Development Planning Unit and the International Ethics Advisory Board member of the EU Horizons program. Her academic career has spanned 30 years focused on health inequalities, ethics, and human rights, and recently, globalization and health. She's a researcher and an advanced master's and doctorate's teacher. She advises UN agencies, including the WHO, United Nations Environmental Program, the UNDP, UNICEF, UN Habitat, and UNESCO. She's a recent winner of the Royal Society Cone Award. With that, over to Dr. Stevens for the first talk.
Thank you very much, Kelvin. Good afternoon, everyone. I hope that you're enjoying these sessions. I've been asked by the organisers to just introduce this session by talking a little bit about globalization and health. Next slide, please. I'm going to run through the basic concepts of globalization and health and how we conceptualize justice, which is perhaps particularly pertinent at the moment. I'm going to look at the scale and briefly of urbanization just to put this whole session in context, then ask you to think about the concept of the global village and think about temporal change and mobility and think about globalization and justice. Next slide, please. The key ideas I'm drawing on from this talk are based on a book that I and my colleagues Ben Hawkins and Marco Liverani have just edited and written for, which is produced by the Open University. I think the key thing we need to think about in terms of where we are on the planet at the moment is the four critical points within the globalization literature. What's happening with globalization? Is it actually happening? What are the reasons behind whether it's happening or not? What's the time frame for what's happening? And the billion-dollar question of what the impacts are of globalization. Is it proving to be positive or negative? And I think the key concept I want to think about today when we're thinking about the built environment, and particularly when we're talking about violence, as we are in a couple of the sessions, I want to think about whether we really conceptualize ourselves as part of a global village. Next slide, please. So, as my colleagues I'm sure will be telling you, we are in a situation where we have passed a few years ago now the borderline of over 50% of us being in urban areas. And if you just look at this graphic, which is the latest by the UN Population Division, we are in cities that are absolutely enormous now. Cities are over 1 million. The populations around the world, the darkest colours here show over 80 to 100% of people living in urban areas, even in relatively uninhabited areas like Australia. The majority of the populations are living in urban areas. Next slide, please. in that context, when we're talking about globalization, we are talking about a set of global processes that really change the nature of our interactions between urban areas as a key factor, and across a really wide range of social spheres. And the one I want to concentrate on is the aspect of social change. I and a colleague in the development planning unit in UCL Bartlett wrote a chapter for our book on globalization and social change, and I think it's one of the things that worries me most. If we go to the next slide, please. The idea of cultural globalization, I think, underpins many of the changes that we see. It's to do with the idea that there's blurring of previously accepted, which differentiates states, ethnicities, and civil societies, such that new spaces of daily life and new types of cultural meaning and new forms of social and political agency now flow across borders. And that has led theorists to thinking about this concept called the global village, which is the idea that people are increasingly holding notions of society that combine both micro level ideas, so where you actually are born and perhaps who your friends are in your local environment, with thinking about world level and macro level identities. And I think we can see this playing out most tragically at the moment with the situation that's going on in the Middle East. And at this point, we're going to involve all of you. So I would like you all to be thinking about whether you consider yourself to be in a global village and to be living in a global village. And we'll look at all your answers. So at this point, you will be invited to be in a global poll. And all of you, I know you're coming from around the world to attend this session, have the ability to then vote on whether you think you are or not in a global village, and we can come back to that. Next slide, please. I'm not going to go through this, but you will have my slides. The key conceptual changes related to globalization are considered to be spatial changes. So that means that particularly between towns and cities, there's massive population mobility internationally. That also means that there is massive microbe mobility. So the coronavirus moved in a way that it would never have done in the past around the world. And of course, global environmental change is meaning that responsibility for consumption and emissions in one part of the globe has very strong impacts in other parts of the globe in ways that we never saw before. And actually the key problematic aspect of this, the temporal changes, it's the speed of these changes that really is hitting us now. And the social changes are to do with what we call cognitive changes. So a shift from mass media to global media, changes in forms of communication. And the idea that we could create global solidarity, or we could actually use these forms of global media to disintegrate as a, if you like, global society. Next slide, please. Just touching on that, if you are interested in these aspects of the way that the world is shifting in terms of cognitive changes and cognitive globalization, a very interesting source of data at the moment is a, if you like, advertising analysis coming from a group called We Are Social that actually use international UN data and use data from all the major providers of social media to look at aspects of insertion and global identity creation. Now they're doing this analysis for commercial reasons, but I think it's extremely interesting because it starts to tell us where people are getting their information from as they make decisions. This slide simply is an illustration to show you how connected people are. through internet adoption. We still have the lowest levels of internet adoption in Africa. Africa remains the least urbanized environment as well. But internet insertion and adoption is widely, well, much more widespread than it was a few years ago. Next slide, please. This slide is more interesting, perhaps, and if you look at the top three aspects of this slide, the top 3 lines of this slide, what I find most interesting about this is the main reasons for people accessing the internet are to find information, to actually educate themselves about news and events, as well as keeping connection with their friends and family. Now, the reason I'm raising this is we as academics are used to a world where we would put out knowledge, we would put out evidence, and we would put out perhaps into peer-reviewed journals, perhaps into books, as I've just shown you, knowledge. And yet we're in a world now where people are across the world now forming their own ideas about what's going on and what's true. Next slide, please. You can start to extrapolate then from that to thinking about what people think of international justice. I'm not going to go through this in great detail, but the central ideas around globalization and justice look at the way that international justice has played out, and effectively what principles should guide international action. I prefer to come back to that in questions and answers, but when we come down to thinking about conflicts within urban areas, I think a couple of the slides I'll show you bring this into focus. Next slide, please. UN Habitat produced a report last year looking at what they call creating a just and sustainable urban future. In their eyes, they're seeing justice as less what action should be taken internationally, but as a fairness between people in urban areas. They also conceptualize justice in that context as thinking about whether or not it would be just if, for example, citizens of London create waste and pollution that would then affect citizens in other cities of the world. So it's both an international justice concept, but it's also a justice within cities concept. Next slide, please. Coming on to urban violence, and we're going to get much more into detail about what you might do within a city. But if you're interested in this, a few years ago now, the World Bank did a very, very good analysis of urban violence and called it an international epidemic. Now, if you are thinking of it as an epidemic, you then have to think about causality. Next slide, please. In relation to causality, this is an analysis that was done by ACLED, which is another part of the UN system, largely the political and economic analysts coming out of UNRSID, which is UNRIS. That's the, if you're not familiar with it, that's the research arm of the UN. This is an analysis looking at conflict data and looking basically at the degree to which political violence and protest violence has increased, but also concentrates in urban areas. So this is urban versus rural. So although we sometimes see violence as, if you like, homicidal violence or violence of one person against another, you can also see political and protest violence concentrating in cities, which leads back into the discussion that I was just mentioning from UN Habitat, thinking about creating a just city. There's a considerable amount of evidence that the more unequal a city, the higher levels of violence. Next slide, please. I also should point out that violence is often linked to what we call exclusion, certainly, and the idea of globalized exclusion has been predicted since the 1980s. Marshall Wolf, for Unrest back in 1995, suggested that trends were indicating that from the 1980s, more people within the global system were becoming permanently superfluous, irrelevant, or hindrances to its functioning. Some people do achieve inclusion in the globalized system, but only if they accept intensified exploitation and insecurity. So this is another aspect of violence that perhaps we won't get into, but it is an aspect that many analysts believe underpins some of the violence that we're seeing in urban areas, and perhaps particularly the protest and political violence. This picture is also, this is a refuse worker protesting at insecure contracts and low wages in Argentina in 2000 during the crisis in Argentina. Next slide, please. I'm going to end by saying that if you look at the potential for the idea that we are all connected being more positive, there is an argument, and this is an example coming from the World Economic Forum, thinking that we can actually create ways in which our ability to see each other, our ability to communicate, can create more solidarity between us to share values and create the global village. And I'll end by just saying that the session that we're discussing now is going to talk about very specific interventions for global, for basically dealing with urban violence. But I want to raise the question of whether or not we can actually do that across the global village we're living in. I'm going to finish on the next slide and then ask people to give me an answer. Does our global village, does our audience now feel part of this global village? I'd very much like to see what our poll is telling us. And really, what does our audience think of the positive and negative impacts of global processes on the urban space and health? And I will stop there. Could we have the next slide and see the results of the poll? Oh, thank you.
Thank you so much, Dr. Stevens. That was a very interesting talk. Yep, going back to the poll, it looks like 55% of our audience has said that they live in a global village. 27% said no, and I think 18%, so not an insignificant amount, they do not know if they are in a global village. So I guess we can start off with that. I wonder if you want to comment a little bit on the results of that poll.
This is a poll. I'm really interested in this result, actually, because this is a poll that I hold with my students every year in our globalization module. And we have over 160 students from all over the world. I would be very interested if any of the participants in the session who said yes would highlight why they said yes, perhaps in the discussion forum, and anybody who said no, express why you think no. normally in my classes, we have the majority of people saying yes, but they also say that they believe that they feel that they are able to say that because they're in a global elite that is able to feel part of a global village. There's a very interesting but not very optimistic new theory around renativism, which is being thought to underpin violence in European cities, to do with largely some people believing that renationalizing needs to occur to eliminate the bad impacts of globalization. So it's a very complex debate.
Yes, thank you for that. That's very interesting. I struggled with how to answer this poll myself. I have a question for you. I'm very interested in your comments on social media and just online connectivity in general as a pathway for human connection and for social change. However, it's also a pathway for misinformation and the promotion of violence and attitudes that are harmful. And we see this a great deal in the United States, certainly. So I'm just wondering if you could share with us your thoughts on that for social media in terms of its positive contributions and its negative contributions.
It's a very complex area. And there you can find empirical evidence that people will use social media to share views that might be considered to engender violence, but you can also see examples where people are showing social solidarity. So we have not in the past, for example, had global demographic or global, if you like, global democratic polls, which enable decision makers to think of a global democracy. So, for example, I can give you a very clear example of that. When the Paris agreements were being formulated in Paris, the French government used a global poll created by Avaz, which is a global democratic poll forum that some of the participants might be familiar with. And they actually used that in one of the arguments that for stronger controls of climate change, so to push the governments towards higher levels of agreement by using a poll that was created by a wide array of environmental NGOs, which is the other really interesting aspect of globalization. The proliferation of social society organizations internationally has been astonishing. One of my colleagues works on that very closely and has written in our book. And that in itself might also allow a different set of voices to, if you like, a policy table, both operating in an urban environment, in a city, to shift one particular city's policies forward, but also operating at an international level. We're in a very interesting natural experiment with globalization.
We have a comment that came in through the discussion forum from Jillian that said she does not engage too much with social media, but sees a lot of, I guess, rapid news, short bursts of news. But that information is something that someone chooses to feed to her. So really related to Michelle's question there, and I think I also think that it's just a very interesting area with both positives and negatives. I live in Canada, and I think a lot of people over the past few years have conflated that sometimes, American laws apply in Canada and vice versa. So I see that globalization and social media as being something that could lead to both positives and negatives. I do not see another question yet in our live Q&A. Um, I was actually wondering a little bit with one of your first slides about that more and more people are now living in urban areas, and that trend seems to be continuing to grow. Uh, I'm wondering if there have been people thinking about whether it's enough that we think about where the lines are set in terms of whether or not live in urban areas. Do you envision um, a future where we're going to start coming up with even more definitions of what it means, what urban areas are, um, if people are going to start thinking about how related to globalization, that how connected certain cities are to the rest of the world?
Within the globalization literature, my colleague Don Brown has actually done a slightly different study in relation to that question. When you're talking about urban areas and cities being as large as nation states used to be in demographic terms, you're actually talking about incredibly complex political environments. The other thing in terms of globalization that has been documented, which perhaps many of our participants will have experienced, is that globalization, and particularly big global economic shocks and economic globalization, hits extremely quickly on urban areas simply because the majority of the population are reliant on capital. They're basically not able to produce their own food or water or find their own water. So they're in a capital intensive environment, which means that when you have a global economic shock, that will hit towns and cities very quickly. And if you're in an extraordinarily large urban area, that will hit very, very, very quickly and hit an enormous number of people. So, for example, in Buenos Aires in Argentina, the economic shock of 2000 moved roughly 40% of people from the middle class into poverty within a period of only 6 months, which is extraordinarily fast. We would not have seen that kind of scale of, or rather the speed of change in the past. That kind of speed of impact is another aspect of globalization that analysts are starting to understand. And in terms of Gillian's point, my students actually are becoming much more adept at understanding and working with the control that media is having over what information people are available or find they have available. I'm trying to word this very carefully because it's always been the case that mass media has a control over people's cognitive ideas of themselves and their lives. But when that becomes globalized, it has a potential to have a very different flavor, if you like, and very different impacts, because it can create a way of people thinking of themselves in a very dystopian way. So there is a theory of urban violence that is linked to people's cognitive understandings of themselves related to their need to defend themselves and their right to defend themselves, which is completely opposite to the type of direction we would potentially want to be going if we were to think of ourselves as holding a shared community and a shared global village. And that's what I think worries me most about where we're going.
Thank you, Dr. Stevens, for a very interesting talk as well as a question and answer. Dr. Bell, would you like to introduce we'll now move on to our next speaker.
Great, thank you. I also want to join Kelvin in thanking Dr. Stevens. I really found that very thought-provoking. So our next speaker is Ronita Bardhan, who's going to talk about built environment design as precision prevention. She is an associate professor of sustainable built environment, and she leads the Sustainable Design Group at University of Cambridge. Her work looks at harnessing data-driven insights to shape the built environment for precision prevention against health and energy burdens, especially under climate change. Her work is highly interdisciplinary, and she bridges the fields of physics, engineering, social sciences, and architecture to forge solutions that unlock health and also low-carbon energy potential for the built environment. She's won too many awards for me to list here, so please join me in welcoming Professor Bardhan.
For the very kind introduction, and it's lovely meeting you here again. Just want to check there you can see the presenter view. Thank you so much. Before I go into what exactly I'll be talking about, I've titled my talk as Built Environment Design as Precision Prevention. Definitely people who are very much accustomed to the health and medical sciences, they know what is precision prevention, and it has been currently being quite a significant amount of work on in the medical field. And I borrowed this term primarily because I want to showcase that built environment actions in built environment can actually work as precision prevention for health. And just to give a very brief introduction of what I'll be showing and what is the background of my work, I lead the Sustainable Design Group, where we work on these four verticals of sustainable development goals, which is health, energy, efficiency, equality, and obviously sustainability in communities, which is SDG 11. So what does this data-driven design for precision prevention mean? It primarily means that I work on various sorts of data. So very quantitative data where we go in on sites, do a lot of monitoring, experimental campaign using environmental sensors or even human sensors. And apart from this, we also collect a huge amount of data on social practices, like how do people live? What is the meaning of any kind of climate change or extreme event in people's life? Because that affects their interventions, their ability to take an intervention, their capability to adjust their interventions based on what is their perceptive risk to health. And using these, I kind of combine them to answer the major goals of our future, which is net zero, occupant health and well-being, energy and space efficiency. And this brings me to today's talk as a background of it, that there are two greatest challenges that we are currently facing. One is extreme heat is one of the part of the extreme weather events that we are facing, and it's going to become more and more frequent and more extreme probably in the near future, and that probability is quite high. Other thing that we are facing, that the global south is experiencing an enormous amount of urbanization in terms of their intensity and in terms of the rapidity. That means there's a large population who will live in urban in very near future, if not currently have started already living. So we do see our future is more urban, as Caroline very aptly said, but our future is also poor urbanites. So how do you tackle with this sort of a problem when it comes to a massive scale of built environment being built to house people who do not probably have a permanent shelter at this point? So taking these two challenges forward, if we look at what has happened over the years, our on one side, while we are looking at a more rapidly urbanized urban future for the world, we are also looking at a more aging population or a more younger population, especially in the global south, we who are probably need more capabilities or lack resources to acquire the capabilities that is required to tackle this enormous challenge of the future. So very aptly borrowing it from IPCC, this image kind of shows that probably children who are born now will face much more extreme future than what probably I am facing, or people who are older to me are facing currently. And that brings us to a notion that how do we meet these sort of challenges? And there's definitely this question of equity versus equality. So I use this image to show that there are lots of traditional solutions that are being implemented to tackle the extreme weather events. And today I'm going to talk mainly about heat and why heat becomes extremely important to be considered as we move ahead. And we see in this image that very traditional solution to combat heat is air conditioning spaces. And we know when these sort of solutions were developed, they were developed with the right intention and they did perform to their ability till it kind of started scaling up. And I think that this resonates with what Caroline said, that globalization might bring us into certain tipping points in the society that might need more innovative solutions, that we might not will not be able to fulfill our needs through just traditional solutions, because our normals have now changed and there are new normals to be responded to. So this brings me to this very critical question. As we urbanize, we have to house these people. So there's a tension between shelter, energy burdens, or energy requirements that will grow up, along with the health potential or burden. So the primary idea of this talk would be how can we use these sort of feedback loops to redesign our built environment as an action for precision prevention. And today I'm going to share a few examples from mainly Global South, where I have been working intensively over the past few years, and try to show what does actually these extreme heat events or extreme heat waves mean to people living in these sort of places, and can it be designed to provide a relief? Is adaptation a method, or what are the challenges in these adaptations? So, if you look at any typical city in the global south, I'm talking cases from India and Africa, you will find the cities are currently in transition. So, you'll find large number of built environments being coming up with different type of form. Some are very high rise, extremely dense. Some are high rise, very low density in terms of number of population living, and some are extremely low rise, extreme dense. So, we do have an array of urban forms that come up, and but then what they do is they exist and coexist together. So they are not existing in isolation. Nobody has planned these sort of built environment. They are an organic response to the demands for urbanization, organic response to demands for better quality of life in the cities. So it's policymakers are providing different sorts of solutions in terms of housing typologies. So we can call them, they are archetypes, different types of archetypes that you will encounter primarily in the global south. Is probably can be categorized into these 5 categories. And just to give you an example of what these diagrams look like, so if you look at these two buildings, they are very tall, but they are very close with each other. Whereas in this sort of an example, the buildings are quite far away from each other. Whereas in this sort of example, there is hardly any space between the buildings, but they are quite low rise. This is a different sort of a configuration, and there's another configuration where the buildings are up to fairly high rise, but not as high rise as these. But their distance between the buildings are probably much more compromised than what you see here. This brings me to the question that are we designing cities that are aggravating the problem of climate change, that are aggravating the problem of heat being trapped in the cities. We already know about the phenomena of urban heat island effects. Are we designing cities to cool themselves down, or are we looking to mitigate heat islands through different other solutions without actually looking at designing places which has higher cooling potential? So we started this endeavor as a natural experiment because the city offered us this natural experiment to be done. And then we tried to see, is there a form that actually cools down faster than other forms? So that would probably give us what are the characteristics that enable it to cool down. What is it that we can design through policy inside these sort of spaces so that it cools down? So if you look at this diagram, this sort of a building looks very high rise, quite high distance between the buildings. These rises to a very high temperatures on a day. This is annual average, so obviously on day-to-day basis the temperatures will be quite high. But if you look at it, it cools down rapidly and then stays cooler. So any temperature below the red line is considered comfortable in that in this particular part of the city. And when you look at this area, you will see quite a lot of area under the curve, which means it is cooler. So we saw that this type of built environment was cooler from 6 o'clock to 10 o'clock in the morning. However, if you look at this sort of a built environment, which is fairly low rise but extremely high dense, it doesn't rise to a very high temperature. But what it rises to is it cools down fairly slowly and remains cooler for a shorter duration of time. So clearly, this sort of form has higher cooling potential than this sort of a form. So can we extract the characteristic and now design cities which have inherent cooling potential? So we looked at different forms across all the 5 forms and tried to see what was the relative risk from heat. So we looked at, we found out there's one particular form that was extremely high in terms of their temperature, but they were quite low in terms of their cooling potential. This brought up to what are these sort of forms? How are they coming up in the global south? So in global south, a massive phenomena that is currently happening is replacing these very low rise informal settlements into high rise towers. And we wanted to see, is this a massive phenomena, or is it a one of a kind that we can just get rid of it and suggest that sort of work can be that sort of built environment not being produced? But we found out that it's not the case. It is actually the most sought for policy in the housing space to replace to make cities slum free and also to replace informal settlements with permanent housing. So it's a kind of a graphic to show how these are housing are coming up. So how does this come up? So the main policy that has been changed is, in normal national building codes, you will find people follow the 45-degree rule. That means the distance between the building will follow this 45-degree line, which will allow enough natural sunshine, daylight, and ventilation. For high-rise building, this degree is kind of steeper with a 63, so 3.5 degree, which means the height of the building would probably be twice or thrice the distance between the building, and that's okay up to a certain limit. But what was happening in these sort of housing was that there was a minimum prescribed distance between the building, and we wanted to see when a policy actually states the minimum prescribed limit for compliance, do actually developers provide the minimum compliance limit, or is there some kind of exception to that rule? And so our intention was to go into these houses, because these houses provided us a perfect natural experiment ground to understand what happens when people move from slums to these sort of houses. Nothing in their lives change, no other factors change except where they are currently living now. So they have not become overnight rich. Their access to healthcare and education and job facilities have not changed, because these houses are built exactly on the same space where these slums were being built. So provides a very good ground for us to do randomized controlled trials and understand what is this housing actually contributing to health potentials or health burden. What is the potential? So we found out this is actually the future, and majority parts of the cities lives in this sort of housing. And moving forward, probably 5 years down the line or 7 years down the line, majority of the citizens will be living in this sort of housing. This is an affordable housing scheme that has come up across the global south on a massive scale and has won a lot of traction from the governments because it closes the housing deficit overnight and also takes away the burden of having slums in the cities and create more slum-free cities. So we in order to do a randomized control trial, we took three different typologies just for a mental image. One was X type, that means the total central core was at the center, and all the arms of where the apartment units were along the arms of the X. Whereas there was the I type, which is a simple double-loaded corridor that we see in major affordable housing, in social housing in the UK. And there was another type, which was H type. This was very interesting because the whole corridor or the access way moves around the periphery of the building. So now the units are inside and it is surrounded by the access corridor. And so just keep this in mind because I'll keep on referring to H, X, and I type. And then we started looking at what is the indoor overheating burdens of this sort of housing as compared to the slums. So if you look at when people living in these horizontal informal settlements, what is their thermal comfort like? Obviously, we would expect that they are extremely poor. But given that there are two different typologies of layouts that have been are being chosen by majority of the governments, is there one particular form that offers better potential? So we found out that there is definitely one form which provides more number of compliant days in terms of which doesn't goes beyond the certain threshold of thermal comfort, but we are just looking thermal comfort at this point, not the heat burden in that sense. But when we looked at the overheating heat burden, it was a different story, and I'll come to that recently very soon. So when we started looking at the heat stress, so we captured the heat stress, and you can see that just looking on, this is on a hot summer day, the outside temperature, it's a wall outside temperature can go as high as 38 degrees. That also means that indoor temperatures will be extremely higher, given that these houses are much more perforated, given that there's infiltration rates are very high in these sort of buildings. So we wanted to understand what does this heat mean to them. Does it have a different meaning within the same community, or does it have a different connotation? So we just asked people about what is their neutral temperature, that is the temperature at which they would go and undertake any sort of intervention to cool themselves down, or take or switch on a fan or switch on an air conditioning unit if they have access to. And so given that these all people belong to similar socioeconomic status, so we asked so on the top row you can see lots of males with different levels of clothing. It's winter here in the UK. Most part of the northern part of the globe is now winter. And if you turn your jacket, you will see there's a certain value written, and we actually purchase based on the insulation value. We purchase our jackets. So we generally tend to buy jackets which are around 0.9 CLO. Whereas there are in a calmer summer season, our clothing insulation would be probably 0.5 or less. But when we looked at, apart from this young chap who was probably giving into fashion, wearing extremely thick jeans and clothing that was nearly similar insulation that is required for a winter temperature, rest of them had quite varied clothing and nearly very well suited for a summer temperature. Whereas when we looked at women's clothing and their response to neutral temperature, we did find that majority of their clothing had a very high insulation value. And this is on an extreme summer day. And the whole fact that there is very little cultural freedom to adjust the clothing for a female than a male in these sort of communities, that gave us that the burden probably lies to one particular cohort of population. And this brings us to the notion of justice, which Caroline was definitely mentioning, but it is within the same community, there's one particular cohort of population that is bearing the burden. So if you just very clearly look at what will happen in terms of very near future, so we used future climate models to predict what would be the annual average temperature indoors. And you can see that on an annual average on a summer day in around 2018, in that sample, even 2050, the temperatures will actually cross physiological thresholds. And that does mean when you look at the relative humidity and combine the heat stress into it, you will find that probably these people will not have the ability to actually cool themselves down even without having access to some aided cooling. And that's the concern in this sort of setting, where your majority of the population is urban poor, do not have access to massive cooling. And even if they have access to, does the city have the enough capacity to provide the electricity that is required for cooling this population down? Interestingly, when you look at the adaptive comfort threshold for females, they were quite high. That means women do not take any intervention unless they cross this sort of a threshold. Whereas if you look at the males' comfort threshold, it was quite low. So the access to energy device itself now becomes a question of equity and equality in this sort of a context, where a woman often says, and we have got it from our narratives across the world, especially in Africa and India, that they do not switch to any sort of energy intensive cooling devices when they are alone in the house. And this goes to the context of cultural empowerment. It goes to the context of definition of a good mother or a good wife, to save the resources, so that the burden of a high electricity bill doesn't fall on her. And this is where the equity and justice comes in. How do we solve this sort of inequity and justice problem within the same community? So we went on and we did a narrative survey, and I'm going to share a small little snippet of our work here. Sorry. But can you see the subtitles? Yeah, subtitles. Sorry, the audio was not audible, but it was, they were speaking in their local language. But what you could see is they were talking about, after they moved from slums to these sort of houses, their number of healthcare visits have increased nearly, they said 10 times, but when we did the survey over and over again, it's nearly 2 to 2.5 times that it has increased. Also, the range of vector-borne diseases have increased quite a lot. People falling sick has been quite high, and their energy bills are extremely high when they move into these sort of places. So what is this question? How are we building these sort of houses which are actually relieving people from be living in temporary settlements over generations in one particular city to getting a permanent settlement in one particular city? But then what does it entail when you get a free house? Does the house is actually free, is a question that we need to understand. So this is where I think building design becomes a precision prevention technology for these sort of settings, where we can actually relieve housing, design housing to relieve these sort of burdens. And I'm going to show you a small little example. So when we did a survey on understanding the symmetry of people visiting doctors, and we asked them, what is your change of visiting, number of people or number of times you visit a doctor over the past 6 months. So they said majority of the population said the rate of increase of visiting doctors have increased by 5 times. And not only that, we wanted to see the symmetry of living in which floor. Obviously, living in the ground floor entailed much more, had more higher frequency of visits, or the first floor, whereas if you're living in the upper floors, this burden is lesser, and that frequency is lesser. And this kind of talks to us about that building design is probably one of the critical criteria in relieving the health burden that these population are facing, just because they live in a certain spatial configuration. And so looking at this, we started looking at heat stress, which is a physiological indicator to say whether your body will be able to cope with it. And we found out majority of the units will actually be, under the current scenario, will actually remain heat stressed for 24 hours. And needless to say, when we expanded this work in Kenya, where we wanted to look at what is the impact of intervention that is a side effect phenomena that happens. So Kenyan government has done a massive amount of work on in terms of reducing the vector-borne disease by installing a lot of mosquito entry prevention technologies. But what it entails in terms of the whole practice living for people living in the houses, when these sort of technologies were installed, the practice of cooking was outdoors, so women could actually cook outdoor and leave the pollution outside, while they could enjoy a much more pollution-free less heated and indoor environments. But because mosquitoes are attracted by the cook being food and the smell of cooking and the fuel burning, the whole practice of cooking now have shifted indoors. Over the years, when the mosquito prevention technology is now being dismantled, but while the government actually installed these sort of mosquito prevention technologies, they kind of closed many other openings. So now the houses have much less openings. Mosquito prevention technology is now being dismantled because now they need maintenance and active maintenance by the occupants, which they are not doing. So now the houses are registering extreme high average temperatures, and we did a survey of 30 houses which are typical in a typical this sort of rehabilitation community, to see whether the temperatures were even closer to physiological thresholds, and they were always relatively higher. And this is a part of ongoing project, and we'll definitely share more as we proceed. So coming back to what is the concentration of pollution concentration in these sort of houses. So we did a experimental campaign installing sensors in slums versus this I type and the H type in these sort of buildings to understand what is the burden. So you can see here, we also rented one of the apartment and converted into a lab. Basically, we converted into a living space, and that was our living lab, because then we could do a lot of natural experiments on closing different sorts of combination of closing doors and windows, switching on the ceiling fan, adding more surfaces, because more number of people means more number of furnitures and other sorts of things that attract a lot of pollution particles, and wanted to compare between the slums and the slum rehabilitation unit. And we did find the slum rehabilitation unit does have quite a higher threshold of indoor pollution concentration, to the effect that sometimes the close, because of the public thoroughfare is right outside their window, they close the windows while cooking, and that can have an effect on the air exchange rate by a factor of 15. Ceiling fans, if they use it, sometimes often they don't use it because they're alone and cooking, that can increase the air exchange rate, but that doesn't increase it. It's just a slight increase and doesn't increase to the level that it will reduce the health burdens. So we started looking at is there a way, now that these houses are built, we were basically trying to provide solutions. So we said that let's introduce one thing in the whole house, is add a partition wall. And this partition wall is currently not there. It's currently a complete space where they have a window here, they have a unit here, or sometimes the kitchen unit is here, and the window opens up to the thoroughfare corridor. So we wanted to see if there is a way to move their living area out of the total pollution plume that we are calling it, but it doesn't reduce the ambient pollution, but it does remove people from, especially children sit on the bed throughout the day when they are younger and do all their activities, so they come in the direct plume of it. So we did find a configuration which was where you can put the bed location at some point. So if you move the bed location at some point, if you move the window, if you have a certain configuration of partition wall, it can actually reduce the plume concentration. You can see at some of these points that the plume is really negligible over the bed area. Given that, so we said that let's now look at solutions, because this is without solutions, this exercise doesn't make sense. So we started looking at what is the ambient concentration outside. So it was way above any sort of World Health Organization thresholds, which say any kitchen area should have around 50 microgram per meter cube particulate matter concentration from and on an ambient it was around 800, because that's also a contribution from outside. So we said that let's keep all our windows closed and see what happens. It increases as high as 1600, 1700, nearly sometimes 2000 microgram per meter cube. But if you just open the windows, just by behavioral actions, you can reduce it to a significant level. But that level is not as doesn't have compliance to World Health Organization, but it does reduce the burden. But if you just combine these sort of technologies with behavioral mechanism, with some passive technologies like having an HEPA filter or some, these kind of can get reduced by 94%. But we said HEPA filters are costly. So either they are provided by the government or the builder that are building these sort of houses. Can there be another solution? So we just, if you just install an extract fan, which is such a simple solution, then it will probably resolve the problem at immediately. So it reduces still 98%. And so we said that let's look in houses which has actually these sort of ventilators or extract fans. So when we looked at the houses, because there wasn't any provision for extract fan, what happens is the extract fans do not work perfectly, because they are closing rest part of the window for the extract fan to actually work and actually throw out the pollution. And that brings us to the challenge that probably if the developer would have provided the extract fan along with these houses, probably the burden would have been reduced. This brings me to the last part of my presentation, where we worked with doctors who treat tuberculosis patients in these sort of communities, and they were noticing quite a high incidence of tuberculosis incidents in these sort of houses. And that brought us to the whole question. Let's look at these sort of configuration and see if there is the building, there's a correlation between these built environment variables and tuberculosis incidence and actually prevalence. So when you looked at the daylight, and wherever there is more red and yellow, that means light is reaching that sort of a unit. But if you look at the H type, actually the corridors are the only place where the light is limited to. None of the units actually receive any light. And if you remember the video where the woman was standing at the corridor and was showing inside, it was broad daylight, 11 o'clock in the afternoon, in the morning, and there wasn't any daylight inside. And when you looked at the ventilation, the H type had very poor airflow, whereas the X type did have quite, H and I type had very poor airflow, where the X type has ambient airflow. So we looked at just the incidence rates that was reported tuberculosis, and in this sort of case, reporting would be high because dot center people actually go into the houses to see if there is an incident. And we did find the X type was reporting much lower values than the A8, than the I and the H type. And so our next hunch was are these population who already had tuberculosis before they moved into these sort of areas, or is it something that these areas are contributing to? Because we cannot definitely say there is causality. So we found out that when you live in the I type and the H type, most of the people actually develop tuberculosis after they have lived for 4 to 6 years in these sort of houses, where in the X type, most of the people who reported tuberculosis were within the 6 months of their transition to this sort of built environment. So they're clearly, they might have contracted when they were in the informal settlements. And it also clearly says that built environment can be designed properly to reduce the burden of health. And during that time, this was done in 2018. And so when we also predicted there will be more females than males that will report tuberculosis, which is generally not the trend across the world. Even in the country's averages do not say that it's more of a male disease than a female. In 2021, actually people found out that men dropped by 12% and there was an increase by 7% in the women cases. And that brings us to the whole context of what is this what are these houses? Are these houses being built and generated for better health? And can we actually look at the design of houses as precision prevention? So we wanted to make this more available. So we did an impact campaign around this. So we asked women to actually create TikTok films about 5 moments of their lives in 5 days to see what exactly they do, what sort of energy appliances they interact with. And also this was a novel idea during COVID, because we couldn't visit and do the workshop with themselves. So we said, let's do it through TikTok films. And so they gave us these 15-second clips and we joined all of them together. It doesn't have a sound, so I'll just play the film and you will probably see some of the subtitles. Yeah. And so that brings us to the question that we often do not see factoring gender in impoverished settlements to beat the heat. So we never consider data on gender. So we strongly feel data gaps are the culprit, because these gaps are never captured by national data sources. Even in census, it's always household type, and often these sort of differences in gender doesn't come in. So this is just the last slide where we look at we did a feedback campaign where we showed that when they open their windows, we told them smoke, but it was actually particulate matter that could be removed within 15 minutes. Whereas if they do not open their windows, it can take around 2.5 hours. And this was an infographic done in the vernacular language for the women to see their burdens visible. So we generally say that when you want to make health impact as a tool for, and considering built environment into it, we need to consider the acceptability of solutions. So we can have lots of interventions, but maybe they are not acceptable, so that doesn't work in a particular community. This brings me to the concluding slide, where what do we do going ahead? How do we tackle this problem of inequality within certain settings? And the equity question is, first we recognize what and calculate the burden by also considering the culture and the context. We ground the burden in interlinking SDGs, and that helps us recognize it much more. More reflection has to be done on people-centered approach, making the risk information more tangible. When we showed these videos to women, they were very surprised and said that we work so much we didn't realize. And that's a big empowerment that these women get when they negotiate with policymakers about give us this place and some, or give us that place. And that brings me to this can help us in informing policy through evidence. And finally, in order to assure that we are transforming the society, we have to transfer the agencies, which will also help us generate new data and information, which will make it more visible. And if nothing else works, we do say that built environment can be a climate action. And if nothing else works, I always say we should pray. Thank you so much.
Great. Thank you so much for that great presentation, as always. I have a question for you. So what you're dealing with is a lot of policies and strategies that were designed, we can assume, with good intentions. So to get people out of informal settlements and so on, and then have these incredible negative unintended consequences. So I'm just wondering, what are your thoughts in terms of your engagement with the policy community and decision makers in terms of how they are interpreting your findings? Are they surprised? Are they reevaluating their decisions? Or do they feel they have limited capacity to respond? I'm just interested in your thoughts on that.
Thank you, Michelle, because this is a very important question, and I definitely get asked this quite a lot because I do make my research quite visible to the policymakers. And often to my surprise, I have heard the policymakers say to me that nobody actually showed us this sort of an evidence. So it's not always that we blame policymakers and say that they don't want to do anything. Often the results are not visible to them, like it was not visible to the women that they were working so much. So one is, I think, one of the impact that has had of these sort of policies is now the policymakers acknowledge that what we did in the sort of exercise, in these sort of expanding exercises, is actually making things much more visible to the policymakers. They do take acknowledgement of the fact that they need to take interventions, and over the years there was one intervention that was undertaken by them. They considered it, and so there has been a very little impact on the policy, but there was one little very minuscule impact, that they adopted the extract fan solution, and they said moving ahead probably we'll put extract fan. They also increased, we also recommended that you increase the area by 5%, which is just increase the total unit area so that you can incorporate a partition wall. That has not been accepted, but it is also political will to do it. So when they accepted it, there was a different political party in power, and now the political party has changed. But the memory of these sort of solutions, the memory of the institutional memory of these sort of challenges still prevail. So they know that there are solutions available, and now it's more visible to them. It's no longer that they are completely in oblivion, that they don't know what to do, and they completely don't acknowledge. It's not the fact, they do acknowledge it. So engaging with policymakers, I think that's where our impact videos and these sort of very accessible means of communicating with public media becomes very important. So apart from writing papers, which is definitely what we want to do, we also have to probably invest in a lot of impact assessment, and that's, yeah, time consuming, but it also is quite rewarding in the end.
You combine quantitative data with narratives of people's stories, because I can imagine for different decision makers and policy decisions, they may need data to justify their decision, but the stories can be very compelling as well.
Absolutely.
We have maybe time for one super quick other question. Kelvin, I didn't know if you had a question or if any of our participants had a question.
I can ask a quick question, actually. I thought your talk was extremely interesting, and I'm really impressed by the different solutions that you were able to take. In terms of, built environment for climate action, I was wondering what your thoughts are with regards to certainly some solutions that individually through behavior we can control, but also more, I guess, more upstream solutions.
Yeah.
You were talking through about, which which urban form typology could potentially alleviate some of the urban heat island effect. I just wonder, like, what your thoughts are in terms of, do you envision that, um, no, policy wise is the way that we need to invest our most of our efforts. You were saying that, oh, like, as scientists we should not only think about just public behavior first, but also reach out to a community. I see that you've done both in terms of reaching out to individuals to try to influence their behavior, but also to governments. Where do you think our efforts are best used, if you were, based on your experience?
My personal experience was, it was actually very empowering when women come back and the individual experiences they share, and then we can use that in our models to model the total impact that their lives are having. So generally, if you look at engineering models for quantifying indoor air quality, we would have probably used a stagnant window opening behavior. But if you include the dynamic window opening behavior, it actually makes the results much more closer to the reality. So windows, we often think windows are thermal comfort control, but probably a privacy control to the maximum limit. But it's not really that in these sort of circumstances. So when we did run simulations with including these sort of considerations, that these sort of openings are, so during the cooking time they will close the window, but so the pollution level goes high. But rest of the time they're probably, when they're sleeping at night, they open the window. And so when you combine this into a dynamic model, into an actually simulation model to see what is the prediction level, and then calibrate it through experiments, we found out it was much more closer to, it was easier to predict their heat health stresses, the heat burdens, the pollution burden, and it was much easier for us to correlate. So it was actually giving us the power of the analysis was much more higher. But it is very time consuming. So there are ways we need to. That's why I say there is different data doesn't even exist. This differential data on gender doesn't even exist anywhere. We club human beings into households and get the data. I'm talking about data on national level, where if we would have got this data at a more granular level, which any national efforts can currently do, I think it informs policy much more better than when we are doing clubbing this sort of. So that's why my last comment was, make this invisible data more visible, and through more institutional and policy framework, and include the gender being a very important aspect in the analysis.
Presentation, I really appreciate it. I'm going to hand this back over to Kelvin to introduce our next speaker.
Thank you. Our next speaker is Dr. Mardelle Shepley. She'll be talking to us about gun violence and Greenspace. She's a professor in the Department of Human-Centered Design and a member of the graduate faculty in the Department of Architecture and the academic director of the Institute for Healthy Futures at Cornell University. She's a fellow in both the AIA and the ACHA, and she also has LEAD AP, WELL AP, and EDAC credentials. Dr. Shepley has authored or co-authored over 6 books, and the most recent of which is The Design for Mental and Behavioral Health. She also has experience working part-time in professional practice, and her careers in this area has spanned over 25 years. Let's welcome Dr. Shepley, and we look forward to her presentation.
Thank you. I'm grateful to have this opportunity to present, and I wasn't sure how my presentation was going to fit with my predecessors, but as it turns out, I think we're very much aligned. Dr. Stevens and I have some shared interest in environmental equity, and for Professor Bardhan, as an architect, I found your illustrations quite good. But to thank my own team, I want to mention the participants in this research, which included Katie Bedito, who's an environmental psychologist, Naomi Sachs, who's a landscape architect, and Hassam Svavi, who is an architectural engineer. So this topic that I'm going to address is trying to create an understanding of how design might help address some broader social issues. And of course, with a terrible gun violence problem we have in the United States, I wanted to figure out a way to step up and see if I could play a role, or designers could play a role in trying to mitigate the severity of the situation. So we know from various researchers that nature has a positive impact, and we've known that for many years. Some more recent ones are mentioned here in this list. And we also know that disadvantaged communities, especially those disadvantaged by socioeconomic status, benefit more from green space. We know in the sense that there's research that support that. So this particular research project, now 20 years old, Quo and Sullivan, they were wanting to know, if you see the images on the right, you're looking at down a bird's eye view of some apartment complexes which are identical in configuration of the building, but the green space was radically different. And they wanted to see if those buildings had different amounts of violent crime related to the green space. And in their lovely illustration here, this is a demonstration of their findings, that basically the higher the vegetation, the lower the number of crimes, and applied both to property crimes and violent crimes. And there's interesting work on urban blight remediation, typically which involves some greening. This project, which is relatively recent, has been looking specifically at the impact of this remediation of a particular site in a building location or a particular lot, and I will come back to addressing that shortly. So the primary question for our research study was, what is the impact of urban green space on the frequency of violent crime? And we looked at it post-2000. So this was actually this massive effort to understand what other people had determined or found based on their various studies. So this was this is really, sometimes this is referred to as a systematic review. I would say this was a scoping review, because we didn't really know how broad our search would have to be to understand what people had published on this topic. So it happened over a 2-year period. We wound up, you can see from this diagram, we wound up having more than 30,000 titles that we reviewed, some of which were excluded due to duplicates. We screened more than 14,000 titles, excluded from that group, looking then at the abstracts. That filtered down to a series of full text articles, 327, eventually wound up with 45 studies that legitimately address this topic. So this diagram, just to give you a little insight on the graphics, when you see a green arrow pointing down, that's basically saying that an increase in nature resulted in a decrease in crime. So you see this, and I'll briefly talk about each of these. You can see, for example, in the first column, there were many studies in all of these various areas, many studies that demonstrated a reduction in violent crime. And so we were looking not just, all green space is not the same. And we looked at parks, we separated out parks and community gardens, streets that had been greened with trees and walkways, general trees and ground cover, and then we also looked at undeveloped green areas. So those are the categories, and you can see where the preponderance is of studies that have taken place. So if we look at parks per se, the results were inconclusive, and part of this comes from the fact that you cannot, a park is something that evolves over time. It takes decades to manifest itself. So it was difficult to say, okay, let's gather data now with this park with these little saplings and let's see what it's like in 20 years. People, the cost of trying to have an intervention, of course, was difficult, and trying to find natural studies so that would take place also challenging. We did get some significant results when we looked at community gardens and greening, and you can probably relate to that from an intuitive perspective. You know, if there's a smaller scale, you can actually take a vacant lot and add a garden. This can happen over the period of a year or two, so you're able to make some more realistic comparisons. And generally, these had very good outcomes. And vegetated streets also pretty positive, just throwing a few trees and some edging tended to have a very positive impact. There's some issue about how you reduce crime in one street and may bump to the next street. No real confirmation of that. But the relatively inexpensive, and there were actual quasi-experimental studies because you could do pre and post quite quickly. The largest number of studies had to do with comparing trees and ground cover, because you can do aerial views using GIS data, comparing that to crime data by census tract, and see if there was a relationship between the two, and very strong indicator that when you have trees and ground cover more generally, that there is a reduction in crime. And lastly, for undeveloped areas, only a couple studies done on that particular topic, and we aren't really sure how that would pan out because they differ in so many ways. So I'd like to talk about the mediators between green space and violent crime. Like, why is this actually happening? There are, for one thing, it might change the nature of community interaction. So if people are working together with a common goal, there is this sense of collective efficacy, that they are joined in this effort to enhance the quality of community. It may actually provide opportunities for children to participate, and generally a shared interest in the common well-being. So just having places for exercise, a lot of evidence indicating improved health physical health will improve, as well as mental health in these green spaces, and evidence about the impact on depression outcomes and just general health with regard to mental acuity, restoration, and obesity. And biophilia is being discussed very widely now. Pretty clear evidence that exposure to nature has a calming effect. And I should mention, nature for one person may not be the same type of nature someone else might want, depending on whether you've been raised in urban environments or more rural environments. But also the presence of parks gives you a plan B rather than walking around the street or hanging around your house. That might make you feel more empowered. And as I mentioned previously, there's a clear evidence that exposure, even 10 or 20 minutes a day, can affect your mental restoration. Very controversial topic when we talk about the broken windows theory. The basic idea is that when you provide territorial markers, people tend to understand more. They're not as inclined to interject themselves into that particular environment. However, there have been negative ramifications in terms of policing in these neighborhoods, but generally the idea of indicating a territory is going to have some clear effect to an outsider. Community cohesion. participation of users, very important in trying to get people engaged in even the maintenance process. And this could also be perceived as, when you introduce an amenity like this, it might be perceived by community as a gesture on the part of the powers that be, that they respect this community and they want to add to it. So last one, which is probably most pertinent to this conversation, again, all these things I've been mentioning as mechanisms, we're not sure which the contribution is coming from, or which is the most significant. And I have been working on projects subsequent to this to try and determine that. But with regard to climate per se, we talked about heat island effect, reduction in heat. There's clear indication that when things get warm, violent crime can go up, harder for people to maintain their sort of equilibrium. And then, of course, improvement in air quality, filtering particulate out of the air, and the impact on CO2. These things will all contribute to health and perhaps people's perceptions of how the world should be functioning and how their health should be evolving. So going back to this topic, not all green space is created equal. There are clear indication that there are places, apart from the amenities being different, the access to amenities varies radically depending on the socioeconomic status of particular neighborhoods in the United States. There is, during COVID, this came to be quite clear to us because people were trying to access the outdoors as plan B for being locked away in their homes, and not everybody had equal access to these outdoor spaces. So we've conducted studies to see how people respond to this, and whether your racial ethnic background or your socioeconomic status impacted your perception of how you might access green space. So to conclude this, we can say that green space is likely a strategy for reducing crime. Again, I would add that not all green space supports defensible space, is a term we used to talk about a lot in urban design. So design has to be relatively specific to achieve this goal. The mechanisms I list here, it's hard to say which ones have been most effective in terms of achieving the outcomes. The project we're working on now is trying to insert ourselves into communities, bringing on community members as equal members of the research team, and having them make recommendations as to which of these particular mechanisms we should be exploring. So participatory, community engaged research, trying to have people fully participatory in this process. And with their engagement, we've been seeking funding to actually pay for members of the community to participate in this, so they are not being sort of falling victim to a lot of research that happens where researchers come in and out, they gather information, and the community itself does not actually experience the benefits of this. So having more engagement is quite important. And there's cost benefits. So we have a study we did subsequent to this where we took, where there were before and after situations. We combined the data from 8 different studies and did a meta-analysis to determine whether when you compile the data, whether there was still this reduction in violent crime, which we did find for most types of green space. And we also learned that, of course, we were saving money. It wasn't completely accounting for everything you spend when you have one of these interventions, but it had a positive effect on things like reduction in police being involved, hospitals, courts, but also the measures we couldn't quite take were, how is this positively impacting people's health outcomes? So when you improve the quality of people's health, they're more likely to not have to enter the medical system to be treated. And so they're costs that we cannot measure, but just out and out costs. What does it cost to insert this park versus what does it cost in terms of the impact of say, in this case, we're looking at gun violence, that kind of violent crime. And we like having this data. We hope it empowers governments to make decisions when they think, oh, not only are we improving quality of life, but we are saving money overall. And these two studies that I mentioned here at the end, the meta-analysis, that is I have the references listed at the end. That is the link to that particular study. And our one that I've not talked about yet was trying to review the literature to see who is actually participating in community engaged research. And of course, the outcomes of that are very few. So these are the related papers. I know these slides are available. So thank you. I'm ready to answer any questions that might be out there. Would you like me to stop sharing?
Thank you so much, Dr. Shepley, for the very interesting presentation. I personally also work a little, and it touched a lot of points that I'm always thinking about in my own work. But I do have a question for you with your expertise in this area in gun violence, or just violence in general. One thing that always comes up, at least for me, it's like, especially in urban areas, how do we distinguish between green space and recreational spaces, or just parks that aren't necessarily filled with trees or grass, but are a place for people to convene? So, for example, during COVID, people could go out and take walks in those. I wonder if you have encountered in your work whether or not these two sort of types of spaces, or I know they have a lot of overlap, should be looked at in different ways.
Yeah, I can't say that I've seen anything that's compared the two. My intuition would say that providing any kind of recreational space that would address any of those mechanisms I was referring to, like having community come together or having a place to toss a basketball in a hoop, that probably is going to account for part of what green space is that has the same attributes would do. So one of the issues about green space is it needs to be maintained really effectively, and it probably is a little bit less burdensome to work with recreation areas that don't require trimming and all of that. So it may have its benefits. So I certainly wouldn't discourage people from going to straight up recreational areas, even though they lack the green space. But I would also say when you're in a recreation space that doesn't have green, you do have sky above you and access to daylight, trying to deal with seasonal affective disorder. That's also part of nature.
We have a question in the Q&A section that I'll read out. It's from Soki. It says, Dr. Shepley, thank you for a great and inspiring presentation. Some articles say that the mediation analysis is important to find the most effective pathways for public health effects. I'm curious if you're considering finding out the most important mechanism is imperative in terms of decision making.
Right. So that is the study that I'm trying to get funded now, and it's not easy to get funding in this area, is not just to find the mechanism, but work with the community to get their early input on what those mechanisms might be based on their experience in the neighborhood. What do they consider to be the most significant mechanisms? And we probably start with that knowledge to move forward. But that's what I'm trying to work on right now. Which of these attributes it has the most impact? And but not just from I feel like I need to get outside of my own perception of the world, my own life experience, and make sure I'm working with people that have the lived experiences in these particular environments to help me sort this out, and my colleagues.
Thanks so much. I have a question for you that relates to time of day. So I think it's very interesting how you talked about not all green space is created equally, but there also is some evidence that the impact of green space on crime depends on time of day. So you can have a very positive interaction with the community, with social cohesion and a place for exercise and so on during the day. but then increased crime at night. I'm wondering if in your synthesis of evidence and your own research, if you've given, well, I'm sure you have, if you could share with us your thoughts on how time of day impacts green space, or how a given area of land can have both positive and negative impacts on the community.
Well, the topic of time of day also relates to the topic of lighting, and during certain times of year, we might only have 6 hours of daylight or 8 hours of daylight in a given day, and if people are accustomed to doing certain things, say at 4:30, sometimes of year the sun's going to be out, and other times not. So, introduction of lighting, I think, helps deal with some of those issues. As you talk about it, I'm thinking people's frame of mind. When you wake up in the morning, as opposed to the very end of the day, certain amount of I've read studies that say at the very end of the day, people are tired, but they have left a lot of the world behind, so their stress level actually is less at the end of the day. And people used to say that first thing Monday morning was the time of day that most people had a heart attack. So. Facing what's coming. So I think there's probably some evidence about that. And the second thing you asked was not about lighting. It was about you said the physical environment more generally. I wasn't sure what you were referring to.
I was just wondering, just your general thoughts on a given area of space that can have both positive and negative impacts. And so an example of that could be a place where green space has, I'm going to call it, positive impacts on the community with social cohesion and a place to be during the day, but then an increase in crime in the evening. So I think my point there is that a given area of green space is not necessarily completely positive all the time, even though if there are negative impacts, it doesn't mean there aren't also some positive impacts as well. Just interested in your thoughts on that.
Right. That's, because I'm a designer, designers tend to think we're going to solve all the problems of the universe by introducing something into the physical environment. Of course, it has a lot to do with humanity, and apart from spaces that are safe sometimes and not safe other times, there's a certain role that culture plays in this process, and some communities are more accustomed to having their social interactions at different, later in the day. And that may also, the defensible space principle was that if a space is visible to others, your crime goes down. So if it's an area that only 6 houses on the street, no one's there to observe what's going on. But if there are 20 houses and people are sitting on their front stoops, that's a whole other kind of situation. Didn't quite answer your question, but I think we're skirting around the same issue. I understand your concern and your point.
Great. And we do have a question in the chat. Your work is incredible. And they would like to know about the extension in the global south. They lived in Europe for years, and the perspective of green areas is very different from what we see in Brazil, for example, where they live. And they say that despite social and environmental function of these areas in cities, we see that the culture of places is interpreted differently between locations, especially the global north and global south. What are your thoughts on those issues?
Yeah, when I did drop the word culture in my previous answer, my collaborator, Ronita, who is a Brazilian, she is the one who is working with me on engaging community to get their feedback. So she has brought to the table in the paper that we published as well, she's brought to the table this topic of perception of these environments. The same way colors has certain implications that differ depending on where you're from. Green space and the type of green space will also be quite different. So if in our study we're able to make these kinds of comparisons, we will. And I know Ronita would be really interested in being able to bring that to light.
Okay, I'm sure that we do not have more questions. With that, I'd like to thank Dr. Shepley for the wonderful discussion and talk on green spaces in our community. I think this is something that, it's especially a built environment condition that a lot of us have had a lot of encounters with over the past few years, and have far-reaching impacts in our personal lives and overall in our society. I will now pass the mic over to Michelle to introduce the final speaker of today.
Great, thank you so much. So our final speaker is Professor Ellen Hahn, who's going to discuss indoor home radon, and she is the professor in the College of Nursing and the College of Public Health at University of Kentucky, and holds the Marcia A. Dake Endowed Professorship. She's director of several centers. One is UK CARES, the Center for Appalachian Research in Environmental Sciences. That's a NIH P30 center. And another is BREATHE, Bridging Research Efforts and Advocacy Towards Healthy Environments. So she conducts community-engaged environmental health outreach and research to reduce risk from a variety of different exposures, including tobacco use, tobacco smoke exposure, and radon. And her work is especially focused in rural, low-income communities. Thank you so much. I look forward to this presentation.
Thank you so much, Michelle. Hope everybody's enjoying their afternoon. And I just hopped on and heard an amazing talk by Dr. Shepley. So we're moving from green spaces to radon. So I just, first of all, need to recognize my amazing collaborative team, not only from the College of Nursing, Dr. Stanifer, Kathy Rodemaker, and Dr. Rains, but also my two geologists on this paper, Dr. Hannaberg and Jason Backus. So yeah, so let's just get started. Move my slide. So have to do the disclosures to know that this is a grant funded by the National Institute of Environmental Sciences. It's also supported through our P30 Center and our Kentucky Radon Program. And just want to give a shout out to our amazing citizen scientists in the rural counties that we worked with on this project. And you see the citation there. I'm very grateful to the journal for publishing our work. So I'm going to talk to you today about our study and how geology and radon kind of go together. And so we were interested in investigating the seasonal variation across geographic regions on radon, indoor radon, and how different it is based on underlying geology, bedrock. And so we aim to look at the relationships. You can read the aim there. And yeah, so I am not a geologist. And so that's my disclosure. My colleagues are not on this today. So I'm a nurse and an environmental risk reductionist. And the cool part about this work is that we are all colleagues and we learn from each other. So it was a fabulous thing. So if you don't know what radon is, I felt compelled to give a little background that radon is the second leading cause of lung cancer. Radon and tobacco have what's known as a co-exposure. And so you can see there that the risk is for smokers of developing lung cancer from radon is 62 per 1,000 smokers, but only 10 per 1,000 never smokers. So there is that synergism that goes on between tobacco smoke and radon. But radon is a naturally occurring radioactive gas, and you can't see it, smell it, or taste it, but it can get into buildings. And the issue globally is that few people recognize radon exposure as an immediate health hazard, and few people test. In this country, in the United States, I know it varies across the world, but I think it's a chronic problem that this is one of those environmental exposures that people just aren't aware of and they don't test for. So the focus of our work here was to look at the source of the environmental exposure. And so radon comes from rocks and soil. And so our team really has been working on this issue for many years now, before the R01 that we currently have. And so we've worked with geologists to combine a very amazing 1 to 24,000 bedrock geologic map with some short-term radon test kits, the charcoal-based test kit data in our state, to come up with a geologically based state map. And if you just go to this QR code, you can see that paper that we've published several years ago now that talks about how we came up with this method. But basically, the map shows lots of variability. And if you're familiar, if you're from this country in the United States, you know that most people use the Environmental Protection Agency map that only really has 3 zones, 3 colors. But we've been able to get down a little bit more granularly to show how the different types of bedrock and where they are, and then how the exposure levels, the risk potential, if you will, varies from blue to red. And you can see that the radon is measured in picocuries per liter. So blue is less than 2.7, which is the World Health Organization cut point. And you can see the rest there. So we did use this to kind of guide the study I'm going to talk to you about. So the study I'm talking to you about today is embedded in an NIH-funded project called Radon on the Radar. And so we have 5 aims, and I'm only talking to you today about aim 2. And that engaged citizen scientists from 4 rural counties to collect data, soil, at their property where they live. And they collected soil with the guidance of the geologists on their property, and also collected weather data and their indoor radon data at the same time. So this is a crazy slide, but I want to walk you through it from the top left down. But this gives you a sense of the whole study in a one quick glance. So starting in the left, we use that map that I just showed you, and we purposefully selected counties based on their radon risk potential. So these 2 counties on the left, see lots of red, right? Lots of red and brown and yellow. So we got a lot of variability and high risk potential in many parts of that county, those counties. And then we matched 2 counties based on sociodemographic characteristics to come up with the 4 counties that we've been in for the last 4 years. Then we recruited citizen scientists. So we recruited residents who lived there, who weren't academicians, but who were interested in radon, and 15 in each of the counties, and gave them these little air things, Corinthium home detectors. They kind of look like a cell phone, but they're digital technology that gathers short-term and long-term radon values, and tested their homes. And then the second aim was the geology aim. That's the one I'm going to talk to you about. And you can see the machine that we use, this RAD7, to collect some soil and around the home. The second layer here are the 2 aims where we developed a library loan program to increase access to radon testing, so that these little machines, the air things, could be in libraries. And then we did some report back. And then lastly, and we're in this now, we're really building local radon coalitions to provide access to more affordable and adequate mitigation, et cetera. So just a quick look at the whole study. So I just wanted to, I think I'm good on time. Yeah. So want to talk about the methods of this study. It was prospective and non-experimental. Over 2 time periods. In this part, 66 citizen scientists helped us. We trained them on how to use their air things earlier in the study. They had been testing with their air things in their home for quite a while, and then also report weather conditions. So they tested for radon every day. They reported their rainfall. We gave them rain gauges and outdoor air temperature daily. They did this daily for 2 weeks, both of those. They kind of did them every day during 2 time points, one in the summer and one in the winter/spring. So I thank the reviewers. If anybody on here reviewed this paper, thank you. Because initially when we submitted this paper, we had the counties on the left there that came from our original map, our geologically based map, to show the variation. And these little dots are where the citizen scientists lived. And so these are the properties that we gathered data from. But this set on the right is what the reviewers said to add. And I'm so glad they did, because it shows how the distribution of bedrock types really vary, and they're overlaying on the properties that gave us soil samples. So this is what we did. During each testing period, geologists drove from Lexington, Kentucky, where I live, to these rural counties, 4 counties in the state, and they visited each property with permission from the property owner, and they obtained soil radon concentration measurements using this RAD7. And then the measurements were also approximately near, 2 meters near, and 3 meters far away from the home during the visit. So the geologists also determined the bedrock type and used a statewide digital model for all these things: the slope, the roughness, the topography, etc. And they also looked at the weather data using the meteorological data online. So this is a crazy busy slide, but basically just describing, the citizen scientists on the left, the 66 that we had, and, just based on mostly women. Our experience in doing research is that most women love to be in these studies, not men less so for some reason. On average, they were about 50 years old, and you can see the rest here, primarily white, because that's kind of similar to where we live. That's a very similar kind of race and ethnicity background, and then et cetera. You can see the rest. We had about 9 of them were tobacco users, and about 20%, I want to point out, most of the studies we do on radon, interestingly, are probably a little biased because most of the people who volunteer have some type of family history with lung cancer, about 20%. That's about right. And then on the right, just a summary of all those variables that I just talked about. So just to cut to the chase, what we found, we did 2 types of modeling. I'm not a statistician, but I play one on TV. But our statisticians are amazing. And so we reported the GEE models, which we thought were a better reflection of the findings based on the type of data and the error, the standard error, and the sample size, et cetera. So you can see here, the things in bold were the things that were associated with indoor radon and predictive of. So age of home. So age of home was predictive of indoor radon, such that those with homes that were young, more recent. So the older the home, the lower the radon value. We'll talk more about that in a minute. We also found that barometric pressure was associated negatively with radon in the home inside. And really interestingly, from a geology perspective, we found that the carbonate bedrock is the kind of bedrock that is primarily low uranium bearing. And so, radon comes from uranium. So we were scratching our heads like, what is that about? Which I'll talk more about in a minute. And then probably intuitively that the soil closer to the home, the radon in the soil closer to the home was significantly likely to be associated with the indoor measurements that we were getting. So a few comments about the strengths and limitations of the study. The strengths, we all believe, working with citizen scientists has been amazing. They're very engaged, highly trained, have amazing questions, point us in the right direction on a daily basis. And it really is one of the greatest strengths of doing this work. Got lots of limitations, the small sample size, although we chose the number of participants a priori just to guarantee sufficient statistical power. And then the data collection delay, which I didn't mention, but because of COVID and because of weather conditions, we wanted to gather data more in the winter, and we had a really bad winter, lots of ice. The soil was so packed that we couldn't even gather soil samples, so we had to delay into the spring. So that's probably one of the reasons we didn't see seasonal difference. Lack of information about HVAC. From these homes, we did ask the participants to close their windows and doors during testing. That's just part of what we do to get a good, accurate measure. So we need to get more data about their HVAC systems, because I guess other literature shows that radon levels are impacted by HVAC, air conditioning and heat, that kind of thing. And then we didn't analyze, even though we collected soil, we didn't have the funding to really analyze it for the minerals in there. And so we're doing that, proposing to do that next, because it could be that there's uranium in the soil that's come out of the bedrock. And then we also didn't look at household water, because most of these participants had public water. Very few, I think 1 or 2, had a well. And we know that radon can be in well water, but not in public water supply. So in summary, what we found is homes built on carbonate bedrock, which were mostly limestone, low in uranium, underscore that. We would expect it to be high. Had indoor radon levels that were about 2.8 picocuries per liter higher on average than homes built on sandstone or siltstone. And then homes built less than 40 years ago were 3,000% more likely than older homes to have high radon. So newer homes, high radon, probably because they're built with energy efficient materials, and the homes, the windows are nicely tight and there's nowhere for the radon to go. Each 1 point increase in log transform near home soil radon had an odds of high radon that increased by about 200%, which really didn't surprise us. And then this barometric pressure finding, there is, the literature isn't, totally conclusive about this, but we found that the higher the barometric pressure in the atmosphere, the lower the radon, which, kind of made sense to us, but really the research is not clear there. But topography and seasonality in our study were not associated with indoor radon. So future research implications, we are starting to explore this thing that we're calling the limestone paradox. It could be that the soil has uranium in it that's kind of weathered on limestone, because typically limestone, anyway, that these minerals could come out of the limestone somehow, but we need to test the soil a little better for radionuclides. And then could be that there's waterborne transport of uranium-bearing minerals due to open fractures and caves, which Kentucky has a lot of caves. We have a lot of kind of open fractures. It's high earthquake region over here, especially in Western Kentucky. And then looking at the deeper bedrock layers, it could be that there's uranium in the deeper layers that works its way up to the top layers. And then obviously we need to look at building materials a little bit more closely. There have been a couple studies on that, but we really need to look at the residential characteristics how they impact radon. In terms of policy, I have a PhD in policy, and I heard one of our previous speakers talking about policy change. It really is the answer to a lot of these environmental health problems, but really to try to get in our country, in our state, and very few states in the United States have requirements for builders, where when they build new homes, to put in the materials so that radon isn't a problem. And particularly in our work, we're trying to translate what we've learned about the underlying bedrock, and could it be really deliberate, especially in areas that we know have carbonate bedrock? Could we make a special effort to build in those using radon resistant new construction in those high risk areas, educating builders on bedrock type, and possibly developing soil testing for uranium prior to building would be awesome, because as far as I know, we really don't have the measurement technology yet to do quick and low cost soil uranium testing. So just a thanks to the journal. This is the paper. This is the link. Feel free to read it. And I'm happy, I think I'm early. That's good, to take questions if you have any. Sorry if I ended early. There they are.
Hi, thank you so much for that great presentation, and also for publishing in the journal. I appreciate that. I really appreciate the interdisciplinary nature. You're thinking so carefully about bringing the science to strategies and helping make communities resilient. I had a question for you. If you could discuss a little bit about the relationship between these radon measures and people's actual exposure, which is going to be different based on things like if it's a one-story home or two-story home, if the home has a basement, if they had radon mitigation measures, and then kind of personal behavior, as you mentioned, with like windows being opened or closed. I was just wondering if you could share some of your thoughts on that with.
Yeah, thanks, Michelle. Great question. Because there's a myth out there that if you don't have a basement, you don't have to worry, which is not true. That is a big myth. A lot of the people we work with in the community think that. And we actually had a home that was up on cinder blocks. It was a mobile home, and they had very high radon, and kind of scratched our head like, what? What is that? It could have been in the cinder block. I don't know. And there's a study out of Miami, Florida, looking at these high apartments that, like 20 stories high. And you'd think, oh, way up there at the top on the 20th floor, how could you have radon? And they had very high radon. So there's a lot of myth and misperception about the stories of the house, but generally, it's a noble gas. So radon loves to just be at the bottom. It doesn't because it's a noble gas, it's very, very dense. So it likes to sit around the basement, the first floor. So what we tell people is test on the story of your home where you spend at least 8 hours a day. So if you're not going in your basement ever, like you have a basement, but you never go down there, or rarely, like you don't even do your laundry down there, you should test on your first floor, because that's, just knowing that that's that's where you're going to be exposed. But the nice thing about these radon measurement devices is that you can move them around easily. You can leave them, and it's real-time measurement. You can see what happens. They do fluctuate, but I thought you were going to ask me about the measurement with air things. They're lovely because you can get 7-day, we look at 7-day averages, and then 2-week averages. And you can actually leave it in your home for a year and see what it is after a year. But anyway, I don't know that I'm answering your question, but story does matter. The stories, how many stories you have. Although, like I said, we recruited somebody for a previous study, had a new home, brand new, to our point, age of home matters. And they said, oh, my builder told me they put in that piping, that that stuff, the radon resistant new construction, where I wouldn't have to worry. But they said, oh, let me be in your study anyway. So they tested, and they found that it was highest in their daughter's bedroom up on the second floor of this beautiful new house, because they put in the pipe, instead of taking the pipe out the roof, they took it out up into the bedroom. And so she was getting all that radon, that baby, that child was getting all that radon. It was like 40 picocuries per liter. And so they fixed their home, and, but what I'm saying is there's so many factors that impact radon exposure. And in this particular study, we did we did ask the citizen scientists to close their windows, close their doors, during each of the 2 seasons, just because we didn't, we wanted to try to control those things. But there's a lot we still don't know, frankly. But radon measurement is important, and you don't know you have it unless you test it. So and most people haven't tested. I bet if we ask everybody on this call, I bet a lot of people will say they never thought to do it. Although Europe, I don't know where, I know people are all over the world on this call, but I know there are policies in better policies in other parts of the world than there are in the US.
Thank you, Dr. Hahn. I'd just like to follow up very quickly with a question, and then go to a question that was asked in a Q&A. My question actually related to what you were getting at with regards to engaging citizens and having citizen science. So it sounds like that at least one of the times that testing was done in, the citizens realized that there was an issue, and they immediately took action. Just wondering, when you have a lot of citizen science form a basis of your study, how many of them, if you're able to share that information, actually took action? Like, dude, when someone saw, well, knew how high reading, we better do something about it now. Or people, do they confirm what they already suspected? It seems like there's a lot of misconceptions out there. So could you speak a little bit about the experience, elaborate a little bit more about the citizen science experiences?
Yeah. I've done multiple community-based trials over my years, 30 years as an academician and a scientist. And I've typically used, very, typical randomized trial designs, experimental designs. But this is the first time I've done citizen science in a community-based, it's not a trial really, in a study. And it is so powerful. I am a big believer now that if you recruit people and train them and make them part of your team and give them, ask them to join focus groups, not just to for me to publish about it, but to give us ideas about how to market the library program or, whatever, they are amazing and engaged. Now, do they take action? That's a great question. We are writing another grant to answer that. So in our first, to give you an idea, in a traditional randomized trial, it was called FRESH that we completed years ago. We gave everybody a voucher. If they tested high and they were in our study, we gave them a voucher for 30% of the cost, up to $600, to help them defray some of the cost. And we thought, oh, that'll be like a simulated tax credit. That'll be great. And only 17% of them over 5 years fixed. 17% of the people with high radon fixed. And I was like, what? So it's gotten a little better so far with our citizen science trial, our study, which we're not done with. We have another year, but we're up to about almost 30% have fixed. And I don't know what it'll be in another year. So it's a little better, but it's not as high as I would like. So we're trying to figure out why that is. I think in these small rural counties, my one explanation could be that we don't have local mitigators. We don't have certified radon measurement and mitigation professionals at the local area. And a lot of people are very self-reliant, very proud. They don't want to ask somebody from 4 counties over to come. Plus, they don't want to pay for it. They think it's going to be exorbitant in price if they have to travel, which it isn't. But there's a lot it's not just money, because we still have those vouchers in this study. And so that's the percent that have mitigated among the citizen scientists. I think it's like 25 to 20 to 30%, something like that. I wish it were higher, but.
That's very interesting. I think it helps people on this call where to set their expectations if they plan to do any citizen science. I'm just going to ask this question from the Q&A, which is a little bit more technical. It asks about, did you notice or account for any measurement variation in the detectors used? So I'm guessing that this Devin is asking about if you use different detectors for radon and if you noticed any differences.
Yeah, that's a great question. We did co-locate the short-term charcoal-based test kits that we use in the United States. Most people know about those. You can buy them at a home improvement store. The little envelope has charcoal in it. We did co-locate those in our study along with air things, and they were very similar in measurement. We do that just kind of as a quality assurance thing, quality control thing. They were very similar. Although I might say they do tend to overestimate the radon level indoors. So I feel better about the AirThings device because it's real-time radon digital technology. It's not charcoal, and it works. You get longer-term data too. Like in our study, we're doing 2 weeks. But really, I think the manufacturer says 30 days. You should leave it out for 30 days. But I think they're accurate. They correlate. But if you look at them descriptively, the data descriptively, the charcoal-based test kits tend to be a little higher. The radon level tends to be a little higher than what you get on a 2-week average, long-term average for the air things. So I think what that says is it just overestimates the level. But typically they're right on in terms of the cut points anyway. I hope that answered your question. I hope you didn't mean the geology technology outside, because I can't answer that.
No, that's the question.
Okay. All
Yeah.
right.
I had a quick question. We have a super short time left, but do you think the fact that radon is not visible, you can't smell it, you can't taste it, and so on, also plays a role in the high number of people that were identified with high levels but did not take mitigation action?
I think so, Michelle. I think our risk messaging leaves a lot to be desired. I mean, there's a lot of nuance that we're not capturing. And our next studies, we're going to do a clinical trial actually on risk messaging with the different groups, the never tested and the high but not mitigated, because those two target groups really deserve further research. Like, why don't people test to begin with? We can hunch. And then what risk messages could actually increase intention to test, actually, and increase testing, actual testing. And the same with people who've tested but not mitigated. I don't have the answers, but I'm sure it has something to do with the fact that, you almost don't believe it because you don't see it, smell it, or taste it. So why mess with, why do anything about it? Good questions.
Well, thank you so much. So I want to thank you so much for your great talk. I want to thank all of our 4 speakers and my co-chair Kelvin, and thank all of the participants so much.
Thank you.
And thank the organizers of the session as well, IOP, for organizing this great conference and making it freely available. Any last words, Kelvin?
No, thank you, everyone. Thank you for your speakers and the team that's been helping us with organizing the session, and also with the technical help. All been very helpful. Thank you.
Great. Thank you, everyone. Have a great rest of your day.